Welcome from wherever you are in the world. I am your host. My name is Ryan Hines. I'm the Communications Manager at Biomin. I'm joined today by Franz Waxenecker and Dr. Juan Lubroth, and we'll speak to them both in just a minute. Gentlemen, thank you for joining us today. Our topic today is antimicrobial resistance in you. And before we get into the exercise, we would have liked to welcome you in person, for example, to the Biomin Research Center here in Austria. But in the current reality and the era of social distancing, we've switched this discussion to an online format. We're glad that everyone can participate. And the session is being recorded so that you can rewatch it or share it at a later time. Because this is the first session in a series of webinars featuring experts on the topic of antibiotic reduction and food production, we've invited Managing Director of Biomin, Franz Waxenecker, to provide some opening remarks. Franz, good morning.
Good morning, Ryan. Good morning, everyone. Welcome to this webinar, to this first event of this expert series. You see, I'm broadcasting also from my home office, and this is where we all are based at the moment, at least for most people in Europe and across the world. And actually, we can say the world became a bit bigger the last days. So we are limited in traveling, we are limited in our social contacts. On the other hand, technologies like this webinar, this broadcasting, allows us to still interact. And we thought it would be a good idea to still demonstrate, show you what we can say about antimicrobial resistances and the use of antibiotics in animal livestock farming. Before we come to the topic, I would like to give you a short update what it is about with Biomin in these days of the corona crisis. And we can say we at Biomin, we are almost at full operation. All our productions are up and running. We are well prepared to this situation. All our raw material supply chains, as well as the outbound logistics, are working well. And this is not by chance. It is actually planned, as we are following strategies to counteract such crises. So, for instance, we have strategies in place where we are able to deliver any place at the world from at least 2 production sites. We equipped all our staff with laptops, so everyone was able from one day to another to switch back into home office. And even logistics, with good collaboration with logistic companies, we are able to fully deliver products to any place at the world at the moment. It is even the case that some of our machines used in the laboratories, also for antibiotics, are partly brought out to hospitals to help them to increase their capacities in coronavirus identification. And this is something where we can contribute also to manage the crisis here in Austria and in Europe. But let me come to the topic of antibiotic-free feeding and antibiotic reduction. And this is something, one of the new questions our industry is receiving from the consumer. It was maybe not a topic 20 years ago, and it started in Europe with this ban of antibiotic growth promoters. And it was kind of a first step into a global trend. And it was mainly the regulators, the European Food Safety Authority, EFSA, who started with this progress. Today, we see a lot of private sectors following. Many of the retailers, many of the food supply chain people try to get out of the use of antibiotics, try to reduce it as far as possible. And this is a global trend. This became a global trend, and we see this also coming in all markets across the world. I would not even say that this is a kind of negative impact to our industry. I would even consider that these antibiotic reduction strategies help the human medicine and help the veterinary medicine to keep antibiotics working also for the future generations. And today I would say companies like Biomin, we were contributing to this trend, being enablers, enablers that antibiotic-free feeding became even possible. It was not possible 25 years ago. Today it's possible because new solutions are out there. We are investing permanently into R&D to further reduce antibiotic reduction. This is one of our strategies and one of our focuses in R&D. As I mentioned, currently the machines are rented out to the hospitals, but this does not limit our R&D capabilities. It is really something which is very much based on our vision, naturally ahead. We care for healthy animal nutrition, and this is exactly what we want to represent in this antibiotic reduction expert series. And with that, I would like to wish you, first of all, an interesting webinar series. I would like to wish you good health in these days. And just to mention, we are available for you. We are here for you at any place of the world.
Great. Now, thank you, Franz, for those remarks. I mean, certainly at a time like this, it underscores the essential nature of food production and really how important that is, and what our audience here is participating in, feeding the world. So challenging times indeed, but there are some positive elements to that. Now, just one word on today's session. Because we've moved this activity online, it's an interactive session. Essentially, that means two things. First, any participant, any audience member currently listening to today's live broadcast can use the chat function. So you can submit questions right in that box, normally on the right hand of your screen, if you have any questions for either of our speakers here today. And second, it means that we can turn the tables on you and actually ask you some questions to stir the discussion, to get a better picture of where we are collectively and the sort of views that we have represented here in today's webinar. And with that, we're actually going to ask an audience poll question right now. So here we have it. This is for everyone listening. Please go ahead and answer our quick poll question. In the next 12 months, do you expect your antibiotic use to increase, decrease, or stay the same? And right here, you can see that you've got 4 answers. And if you're not sure, that's also okay. Please go ahead and select the answer that's most appropriate. And we're going to give everyone just a second to answer that. We'll give them, let's say, 5 more seconds as everyone votes. I see more than half the votes are in, right? Okay, and great. Lots of participation today. 3/4 of everyone has voted. So let's close the poll. We're at 80% response. Wow. Thank you, everyone, for that. Let's see where we stand. In the next 12 months, everyone, a majority, so 54%, expect to decrease their use of antibiotics of those who are listening here. 31% said stay the same, 9% said increase, and 6% are not sure. Franz, those are certainly interesting results. Thank you again for your time. We're going to, based on what Franz said about this idea of antibiotic exit, that there's a trend towards the reduction of antibiotics. That leads us to our next speaker, our featured speaker for today's inaugural edition of this webinar series, Dr. Juan Lubroth. Juan, thank you for joining us.
Good morning, good afternoon, good evening, wherever you may be. My name is Juan Lubroth, and I want to thank Biomin for inviting me as your first speaker to antibiotic reduction series. I'm calling you from the home up in the Sabine Hills of Lazio, Italy, where I live. I'm most honored and sorry not to have met the membership and leadership of Biomin in Vienna as we had originally hoped. I'm an epidemiologist, virologist, a veterinarian with a doctorate in public health, and worked most of my career in infectious diseases, their prevention, management, and response. My work in the past 20 or so years with the United Nations has been principally focused on international development and not so much on the involvement in the wealthier countries of the globe. Though we see what can happen in one part of the world, such as a live animal market in Wuhan, Hubei province in China, can immediately affect us all. Antimicrobial resistance knows no boundaries either. And this is one of the messages of the webinar today. In fighting antimicrobial resistance, we all have individual and professional responsibilities. So my presentation will be a kind of a broad look of antimicrobial resistance and the food and agriculture systems that we want to keep safe. So this is antimicrobial resistance and you. The outline will look at the global and local contexts of antimicrobial resistance, some of the definitions, the complex epidemiology, what it means in food and agriculture, what are the pressures of the threat, and how we can address some of these. CODEX ALIMENTARIUS, established in 1963 to ensure it's the food safety laws of the United Nations, let's say, between FAO, the Food and Agriculture Organization, and the World Health Organization, some of the gaps in knowledge that we have, and some of the discordant voices around the world that do need to be heard. So antimicrobial resistance has captured global headlines as, and I wrote this a few months ago, this slide, as today's greatest threat to health. And I use 3 little red asterisks there, since coronavirus is in all our minds, certainly. But let me put also coronavirus and antimicrobial resistance in context in the next few slides. But for the last couple of years, we have looked at AMR as the greatest public health issue to deal with. Globally, over 70% of all the antimicrobials are used in food animal production systems. So there are certain outcomes of this use. And this has been described in international fora as a slow-moving tsunami. Sure, again here are the 3 red stars. We can look at coronavirus as a fast-moving one. But AMR, what is below what we can see, that iceberg? So it's important for local understanding of good food production to limit antimicrobial resistance. Now, I realize this is antibiotic reduction series, and at least in communicating with the outside public, the word antimicrobial doesn't roll off people's tongues or understanding as much as the word antibiotic. But very important, and much more important, I would say, in the veterinary realm, is the understanding that we do have parasites, worms, protozoan pathogens, fungi that we need to look at as well when we're talking about these medicines that are supposed to alleviate pain and suffering and ensure well-being. Certainly viruses, and again, coronaviruses, and looking for antivirals is very, very important. That we consider. So we, or at least in my work, broadly we refer to antimicrobials and not necessarily antibiotics. So the global threat, we do see that around today we have around 700,000 human deaths each year related to AMR. Now, 700,000 deaths, this is equivalent to around 2,800 airplanes carrying 250 passengers each, plus their crew, falling from the sky with no survivors. That means 51 airplanes a week, or almost 8 a day, and yet we seem to tolerate it. Now here come the 3 red stars. Look at what we are seeing today on the global scales and coronavirus, and what is happening with the slow-moving tsunami of antimicrobial resistance, human suffering, and death. So things we do have to put in perspective. What is happening with the food consumption? As countries become wealthier, they want to have more protein in their diets, and so the desire for meat, eggs, milk is increasing. And this is also very, we're seeing this with different regional perspectives, particularly in East and Southeast Asia. This demand for meat production and consumption is growing. Latin America and the Caribbean a bit less, and certainly we do see that the population growth in Africa likely will double in the next 80 years to 2 billion people from the 1 billion that it has. And as these countries become wealthier, they will want more protein in those diets. So how to address this? And this is not only terrestrial animals. We do see that in fish consumption is growing. And in today's market, we do see that global fish production is more on farm-raised aquaculture than what is wild caught. And we do see different preferences for different types of meat, depending upon the country and the culture. So this varies. So from a marketing perspective as well, and from improving hygiene or production and marketing, we could target certain countries and certain feed stuffs. This is quite perplexing, and we also see it here, I think, a greater appreciation, even where I am in rural Italy, with the standstill orders or house containment. We are allowed to go to the supermarket and to buy the essentials. And although we applaud our medical, nursing, healthcare facilities, something that I have not really seen in the world today is applauding those markets that have stayed open to be sure that we are feeding the population that wants to be that needs. And in the urban area, how to get food to these cities, and what would be the mega trends that we will see in the future of these large cities, and how do we get food from production safely into these urban centers is a challenge that needs addressing, and logistics, just like healthcare. So antimicrobial resistance, the greatest threat to human health. I hope I've kind of convinced you a little bit about putting in perspective what we are talking about today on AMR and what we are living with the coronavirus. So if we don't address antimicrobial resistance, but today 700,000 deaths to 10 million dead annual by the year 2050, and $100 trillion US dollars in losses. This is extremely significant, and this information is taken from the O'Neill report of 2016. And of the 10 million dead, the majority will happen in under or developing country environments. And the losses, around 66%, will also be felt hardest in the developing world. So how does this compare to COVID-19? Well, I can see that we do need a better communication of the risks of antimicrobial resistance to our politicians, to our international agencies, as well as to the consumer. The problem is abuse, overuse, and misuse of these antimicrobial drugs. And in farm animals, we do see that there are sinks where most is being used, comparative scales of opportunities to use these. And Europe is not so clear in the scope of their use. What is less clear in this particular slide is what's the needs to meet the needs, whether it's growth promotion or whether it is for treatment. We do recognize that there are different disease burdens that differ from country or region to region. So, and then the types of antimicrobials that are being used does vary. In blue is what we are using in animals, and this brownish color is the human use. So, and then we also can look at that intended use, whether for as additive to feed, whether it's the antibiotics, vitamins, antioxidants, acidifiers, enzymes. It does vary, and here I think Biomin does offer some opportunities or insight into what the future can lie, as well as to improve human animal welfare and raising the quality of food, as well as the economics. Now, it's not only in animals. We do see antimicrobials being used also in plants more and more to fight fungal infections, bacterial infections. Now, on the multisectorial approach for antimicrobial resistance, we do need to see what is happening in this environment. It's not only about humans and animals, it's the food, it's the crops, it's the quality of the water, it's what we and how we are managing waste. Particularly, we do see that with antimicrobials, either that only around 60 to 70% is eliminated from the body. Those antimicrobials that are soluble in liquids will pass out in urine. Those that are more lipid solvents will pass out in feces or manure. And we do see that with in livestock or in aquaculture, how quickly we could see the waterways, rivers, ponds, lakes becoming sinks for antimicrobial pathogens or antimicrobial residues. So the environmental component is extremely important to consider. So these life-saving medicines, therapeutic use, are important for the welfare, well-being, and the livelihoods of the animals where we're using it. The prophylactic is a less clear use, where we do see that there is disease and we want to prevent infection. And so that prophylactic use, that is a gray zone of legislation. The metaphylactic use, where we do see that there is a threat and you want to control that threat, that immediate threat to the rest of the group or flock. So the life-saving medicines, unquestionable, I think that we all agree that they should be used. There is a certain sector in the population that will say, no, only these medicines need to be used for human treatments and should be avoided in the use of livestock. And if that were the case, are these people prepared to see a lot more threats or infections and burdens in livestock or aquaculture, and therefore perhaps paying 10 times as much for the products that they want to consume? So the metaphylactic and the prophylactic uses of antimicrobials do raise some gray zones there. We can discuss this a little bit in the Q&A, should you have those questions, and I can give you my opinion. I don't necessarily have the right answer. I think today, the use of growth promotion, I realize the economic incentives for using antimicrobials here, but this is considered a non-therapeutic use, and the World Organization for Animal Health, the OIE, the Food and Agriculture Organization, FAO, have come out very strongly against the use of these antimicrobials for simple growth promotion. And I can give you some more personal opinions on that as well. So what are some of the examples of prophylactic and metaphylactic use? Well, after surgery, there's not infection, yet we give antibiotics to protect that particular patient. Dry cow therapy, common before transportation to just in case the animals are stressed or stressful conditions. So there are places where these medicines do come into question. In food and agriculture, we do see that with intensification of food systems, antimicrobial use is on the increase. When we do have monocultivars or a certain breed or of animal, more antimicrobials are used. The transmission dynamics, when you have the same type of gene pool of the breed, a flock or herd, pond, that we will see more use there in order to protect that particular gene.
Great.
Hygiene, responsible use, communication, and resistance, that is all critical.
Absolutely. And if I could jump in right there, let's take another opportunity to hear from our audience. What we're going to do is launch our second poll question, right? And we're going to, now that you've given an overview, of different reasons for use of antimicrobials, let's see where our audience stands. How would you characterize your goal for antibiotic use? Please go ahead and choose the best answer of the 5 that you have in front of you. You can choose treatment only, prevention and treatment, growth promotion, antibiotic free or no antibiotics ever, NAE production, or other, if one of these isn't completely applicable. And this particular question, we're receiving votes in. More than half of our audience has already voted. We're going to save the results till just before our question and answer period that you alluded to a minute ago, Juan. So thank you all for voting. We've got 3/4 of the votes in. We're going to close the polls, and we'll come back to that later on. Juan, back to you.
Great, thank you very much, Ryan. So I look forward to looking at those results. I think that would be quite illuminating, certainly. I think it would be interesting to know what part of the world are some of these differences coming from, but we can discuss that as well. So what are some of the AMR key questions for countries about key messages for the countries? Certainly, we do need intersectoral coordination. Today, I'm here with the food industry and research and development and private sector, extremely important. This cannot necessarily be a top-down approach of international organizations or the national government working and dictating. There has to be an interdisciplinary cooperation at the national level, certainly. Countries are sovereign, that bring in different interests, have a holistic strategy of how to tackle this. Now, in my view, public health is too important to only be dealt by the Ministry of Health. It does need agriculture, veterinary sciences, commerce, trade, public works to come into the discussions. And I think that this intersectoral task force would need to be included. Certainly the finance and planning. The environment, I think they have frequently been kept at a distance from the discussions and need to be included to be able to have that environmental monitoring, to see if our actions are taking the right direction, and if not, to take corrective measures to ensure that we have a healthy environment where our animals are being raised, where our children are playing, where the future lies. And the private sector are not the enemy, they're part of the solution. Now, I shared with you this slide a little bit earlier to show the interaction of antimicrobial drugs or medicines within the family, urban settings, crops, animals, water. But we have to take into consideration what a lawyer sees. These do exist in the books. There's a food safety law. There's a farming and animal production legislation, pesticides, water laws. So it's important that we understand and abide by all the regulations at play. So improving the regulatory framework is one of the country messages that we want to give out, and to be sure there's coherence between the different ministries and what they're saying, whether it's the ministries of technology and commerce and what they're allowing in or exporting, food and agriculture, medicine. And so I think that this is one of the areas of work where we have seen that there are different sectors follow different regulations. Case in point, when I mentioned about antibiotics or antimicrobials being used in crops, streptomycin, for the people that are dealing with crops and agriculture, they consider it a pesticide. And streptomycin, as you and I know, we consider it an antibiotic. So immediately, if it's categorized as a pesticide, it follows one regulatory framework. If it's an antibiotic, it follows a different one. So this is important for the communication between the different sectors as well. So the promotion of prudent use, what is allowed, what is not allowed, extra labeling uses, that's a gray zone that the veterinarians sometimes use with good judgment, sometimes with bad judgment, but certainly improving biosecurity, vaccine use, better hygiene, water quality, and management practices. This certainly would reduce the usage of the need for antimicrobials. The surveillance, to be able to establish an integrated surveillance system would be wonderful to do, quite difficult, and I'll get to that a bit later. There are quite a few initiatives in the world. We do see that in 2006, the European region has prohibited antibiotics as growth promoters. And I don't want to minimize that the power of the consumers can really change the scene, as we have recently seen the last 2-3 years of the United States. There was a gap between what was happening in North America and Europe, and because of consumers, we saw that gap. And their views on antimicrobial use, food safety, the power of the consumers really have brought in the United States and others that followed much, much closer together.
Right. And
communication. Go, I'm sorry.
Oh, please. Let me just jump in there. Apologize for that. But you mentioned a couple of interesting points right here. So you see different drivers and different activities that are taking place in different parts of the world with regards to the allowance or the restriction of these substances. And also you mentioned earlier, it'd be interesting to know where our audience comes from, a bit how they deal with that. So we're going to actually use this opportunity to ask one last poll question to the audience and get a little bit of insight, because we know that we have participants who have dialed in from the Netherlands, from South Africa, as far away as the Philippines and Brazil. So thank you all for joining. We're going to go and turn to you now to ask a bit about how you deal with antimicrobials in and outside of Europe, right? So please go ahead and choose the answer that best suits. What is your position when selling or formulating feed outside of Europe? Perhaps this doesn't apply. You do not have feed interests in non-EU EEA countries. We do not provide medicated feed formulations in our franchise. We apply antimicrobials only under veterinary oversight. We cater to what the buyer requires or other. Now, please go ahead and choose an answer that is most applicable to your particular business. And I see that we now have nearly half of the participants having voted. So we're going to go ahead and look at those results again. Juan, after you've finished with your prepared comments, and we will set them up right before the Q&A. Thank you everyone for your input. We'll read those out later. Thanks, Juan.
Thank you, Ryan. So one of the most important things that we can do, including and certainly the private sector, quite important, is communication, and not necessarily in that order. I really to be able to guide the discussions and ensure that there's coherent communication between the medical community, the veterinary community, the food safety, that we talk with one voice. So we have, in my previous position as the former chief veterinary officer of the Food and Agriculture Organization, worked closely with the World Health Organization, the World Organization for Animal Health, the OIE, certain private conglomerate entities such as IF, that I suppose that you're quite familiar with, but also the sector-specific, like the International Poultry Council or the International Dairy Federation and others, to be able to share and to write together what would be the right language to be able to educate, make the statements of clarity on the use of antimicrobials or the surveillance for resistance. And this is not only in the developed world, really reaching out in communities. This photograph in Bangladesh, it is women talking to women in their environment, very much of a participatory way. And you can see here also children and young women, families, to be able to talk about hygiene, what medicines to take, what would be appropriate. I do remember once in Senegal on a vaccination campaign for Peste ruminant, PPR. It's a viral disease that affects sheep and goats. And the person showed us that vaccine vial that was being used to vaccinate the sheep and goats. And you look at it and it says tetracycline. So it's not that the person, this person who could not read the in French tetracycline and did not know it was an antibiotic. So I think there's something that we have to do better with communication, pictograms, be able to be sure that what we are saying is right for the population. So now, from a professional point of view, the training and capacity building needs much more strengthening around the world. There's not enough of it, and not enough of it in the different sectors. So what are the guidelines, and what's the training required to be able to implement these guidelines? So certainly there's different opinions out there. There are some knowledge gaps and some research needs from my point of view. Now, in the past, and I don't hear about it much more now, is the precautionary principle or precautionary approach was much more acceptable by more people, was very much of a Eurocentric saying, well, we don't know, so therefore we ban it or we don't use it. Now, a more United States, South America, parts of Asia was saying, no, it has to be science-based. Prove to me that this is, the antimicrobial use is leading to antimicrobial resistance. So these two evidence and confounding results, this was an area of argument, and it took us a long time at the United Nations to really find the right type of language to be able to advance in 2015 some of the common resolutions that we had at the Food and Agriculture Organization and the World Health Organization. to be able to move forward in addressing antimicrobial resistance. I think the science-based risk assessment has a merit, but I do also understand that if we don't know if it does harm, why do we continue to promote it? So we do think that the finger pointing that occurred for the last couple of decades, oh, food and agriculture is using too much, but you, the human human realm, are prescribing too much. That finger pointing is not helpful. And so I think that this has probably come a lot down, and we are working together, most certainly. Now here, 20% of the problem, I'm referring to the environment. Probably the environment is a victim here. And I don't really think that there is much the environment to blame of antimicrobial resistant pathogens or residues, but it's certainly 80% of the knowledge gap. And we do need to look at that environment to see what are some of the risky practices, using the environment almost as a sentinel for our behavior. One thing that is lacking, I think, is a methodology that is acceptable. We do see that in looking at the environment that there are many publications that say, oh, the environment, it is certainly part of the risk to human health or animal health. And we have others that say, no, this cycle is not occurring. So the overlap, is the overlap a lot, or is the overlap very little? So it depends upon who is writing. Science is not very exact there. Vaccine development, improve vaccines and strengthen vaccination areas to be able to better prevention, I think is essential. For in addition to hygiene, it won't take care of it all by itself. An affordable point of care diagnostics so that the veterinarian or the physician knows what to prescribe. We don't have this. It takes days to be able to know the sensitivity of a certain pathogen and then being able to prescribe the right antibiotic or antimicrobial. So alternatives, and here I think Biomin is one of the leaders in looking at some of the different opportunities of replacing medicated feed with these feed additives. Now, in my view, this proof of concept, being able to translate it into commercial advantage and scale is what is maybe missing. And here I can be educated by you. Immunostimulants, if we're talking about disease, well, these are all different feed additives, and this review article from Cheng and others in 2014 is highly recommended. Very important in our work has been the getting multi-stakeholders together in different parts of the world to talk about their views, what the use, how they get their information, what are the best practices, because I think, again, top-down approach is cannot be the column. It has to be bottom up more to be able to lead the way to better hygiene and therefore prudent use. Now, good practices and prudent use in agricultural systems for terrestrial, aquatic, and crop production. There's a lot of documentation that we have done in the United Nations, and I'm sure at the local level, to be able to communicate better to the producers. And some of these manuals or guidelines are available for free for all of you. Now, the epidemiology is quite interesting in my view. We have all heard from farm to fork, from stable to table. What's missing in that is something happens after the table, something happens after the fork. And that is in urine, in manure, in feces. And again, that environment is important that we're have that exposure. This particular slide is stolen from the Department of Health of the United Kingdom, and I won't go into all the ramifications, but we do see that animal food, probiotics, feed additives do influence what is happening with the antimicrobial resistance increase in food animals and therefore health. And here we have the focus on the environment, about the slurry pits and how that affects pastures and crops and the environment, or sewage treatments from clinics, farms, urban centers. Now, when I was at FAO, we developed this the FAO action plan, which, well, I guess I'm enamored with it because I wrote it pretty much, and therefore I want to share it. It has 4 components. Improve the awareness, communication, communication, communication. Show me the evidence, that surveillance capability. Strengthen the legislation governance issues, and promote the good practices. Now, governance is it has to be good governance across the board, and it has to be coherent. We developed also at FAO something called a progressive management pathway. Little by little, step by step, with awareness. You don't know where to begin as a country or as a sector. At stage 1, start off with this, and you go to stage 2 and stage 3. So a progressive control, stepwise, to be able to get where your vision is. What is your end goal? What do you want? That's stage 4. The same thing with evidence. What is stage 4? What would it look like in your imagination? Or that of your stakeholders, or that of this multidisciplinary team that has gotten together at the national level. So if that's stage 4, that's your vision, what needs to take place? Stage 1, stage 2, 3, and 4, until you get there. Same thing with good practices and hygiene, and the same thing with governance at the legislation. What do you want? A coherent legislation at national level? What needs to take place at stage 1 to get there? So that vision. So this comes from global initiatives of looking at antimicrobial resistance, from the Global Action Plan on AMR, monitoring and evaluation, tripartite work plan that we had, with tripartite being WHO, FAO, and OIE, the report of the Interagency Coordinating Group to the UN Secretary General, and like I mentioned to you already, the FAO action plan. Strong food systems controls, HACCP, raising awareness, increasing knowledge, and applying these new tools, getting the right scientific advice. So the objective is the prevention and minimization transmission of antimicrobial resistance through the food chain. Several international actions, have taken place over the last couple of years. And right at this stage in 2020, at WHO, there's an establishment of a One Health Global Leaders Group to tackle antimicrobial resistance. This is at the international level, but certainly at the regional level, whether it's the EU or Africa Union, there are also regional initiatives. So how to address and contain AMR? Take the country strategy to country action. Reduce the unnecessary use of these antimicrobials. Ensure that there is prudent use. Phase out antimicrobials as growth promoters. But I would also support banning those that are critically important for human medicine. Real cooperation between human health, agriculture, and certainly upstream prevention, hygiene, nutrition, vaccination. You could measure country progress at this WHO site of an annual questionnaire that is being sent out, and we do see improvements, or at least improvements in reporting. And here are 3 different videos that you can log on to see what is happening in the UK, Kenya, Bangladesh, and antimicrobial use. The private sector, critical, important, is particularly in feed. And we've published something with IFIF on the good feeding practices. CODEX ALIMENTARIUS, I mentioned this before. This is the food safety law established in 1963 between FAO and WHO. And there's a lot of references of the use of antimicrobials in feed or residues there. So what are the code of practices to minimize and contain antimicrobial resistance? I mentioned integrated surveillance. Sounds good. 15 sectors, let's say, turkey, beef, swine, bees, poultry, crops, smallholders, medium, intensive. This is 45 different sectors. Quite difficult. And then if I look at the critical control points for surveillance, the feed industry, effluents, waste management, pharmaceutical companies, I'm over 50 different sectors. So it's a sound idea. It's difficult, but we need to start somewhere. This market research report, looking at animal feed additives, I strongly recommend it to you. It's looking at some sort of forecasting, and you probably have more of an interest in this than I do. The conclusions we need: more cooperation among key stakeholders and the membership, international solidarity to support low and middle income countries, because somebody else's antimicrobial resistance will be your antimicrobial resistance in cases in your country. It is transboundary. To have a methodology for more risk assessments that can be compared across the border, surveillance across the board, surveillance and reporting in countries, research and public-private partnerships approach, make sustained the animal health and welfare, and ensuring food safety and food security. Engage the global action plans to national and coherent practices. So thank you for your attention, and I hope we can meet soon in person. This has been a true pleasure. Ryan, back to you.
Well, thank you so much for those comments. I think it was really interesting to see your personal and professional engagement in these topics, leading these at the highest level over so many years. Clearly, we had to put a lot of material into a short amount of time, but we do have a few minutes for some questions from the audience. But as promised, before we jump into that, let's go ahead and review those audience poll questions that we said we would save till this point in our program. So we asked questions about how people would characterize their antibiotic use. And here we see that 57% of our respondents said treatment only. 26%, so a little over a quarter, went for prevention and treatment. We had 0 audience members say they use antimicrobials for growth promotion in today's session, and 15% are looking at antibiotic-free or NAE production, the 2% of other. And we won't have time to dig into the rest of those, but let's go ahead and have a look at the second, or the final poll question result to see how you stand on this position as we enter our discussion. So this was again our last question for the audience. What's your position when selling or formulating feed outside of Europe? 15% of our respondents didn't have feed interests outside of the EU. There were 12% that do not provide medicated feed formulations. 41% did so only under veterinary oversight, which is encouraging. 18% cater to what the buyer requires, and we had 14% for other. So that gives us a sense of where this group is. And as we go into our Q&A, we've received many questions. We're not going to have time to address them all, but let's go ahead and take at least a handful to start. So Dr. Lubroth, I'm going to combine a couple of questions into one. We had questions about the use of antimicrobials in plants, use, overuse, misuse in human medicine as well, and whether those controls and whether the scrutiny is as tight or as high, as intense as it is when it comes to animal production. So how much of antimicrobial resistance is due to food and food production and application in animals? How much of it comes from plants or human medicine or others?
Okay, I'll try to answer those questions with some thoughts. Excuse me. The use in plants of antimicrobials or biocides is probably not really well known. And this brings me to a different point. We don't really know how much, let's say from a global perspective, how much is being produced of these different antimicrobials. How much is being used in that country, how much is being exported and used elsewhere. So who are the producers, who are the buyers, who are the sellers, and what's their destined use? Is it for human medicine? And there is it for aquaculture, for crops, for terrestrial mammals, for pets, which an area that I didn't go into is pet treatment, which live very closely with humans. So we don't really know how much is being used in plants. We just see an increase of reporting of their use. For dates, for olive trees, for oranges. And then there's maybe unintended use where you see it with irrigation. So who is manufacturing, who's buying, who's selling would be a very, very interesting data that I would like to be able to use to monitor global trends over the next years to see if we're really decreasing their use because countries are not importing or countries are not able to export and produce, and so therefore manufacturing companies are doing something else.
Okay, great.
Now, and the misuse, I'm sorry, about the misuse of humans. If I can just quickly answer that one. There's probably quite a bit of abuse in overprescription or over-the-counter purchasing. I'm able to do that here in Italy. The pharmacist knows me. The pharmacist knows that I'm a veterinarian. The pharmacist knows that I can get my antibiotic here in Italy. Yes, I'm responsible, but no, I'm not following the regulations. So I'm guilty as well, and I'm sure all of you are as well. Have you looked in your medicine covers and thrown out, properly disposed of, antibiotics or other antimicrobials that you may have sitting on the shelf there, taking it to the pharmacy and disposing it, or do you throw it down the toilet? So we are all responsible for this. Thank you.
Right, so it sounds like it's much less about blaming one sector or pointing the finger, this blame game you referred to earlier, but more a responsible use and stewardship across the board, that we look at all sectors and do our part.
Yeah, and it starts at home. It starts in your medicine cabinet.
Absolutely. We're going to move into now a few more technical questions. So this one comes here from a poultry producer in India who says that intestinal health is a major issue in broilers, but that most antibiotic growth promoters are many years old. Coccidiostats are also quite old in some cases, and that it's seen that some of them, at least some of these substances, are less effective than in the past. So what tools or what ways do we have to limit or manage poor gut health, which is essentially stealing profit margin from the broiler producers?
Okay, well, rather than to look at the medicated feed issue, I would looking at the progressive management pathway and looking at those good practices. Okay, so you want to have that profit, you want to have margin, and you want to have a good product that is healthy for the consumer and also healthy for the pocket. So what can happen more upstream as far as from intestinal health? What is the water quality like? What is the environment in which those broilers are being raised? The workers on that particular farm, that sort of training or that biosecurity, changing shoes, boots, flip-flops, gloves, what have you. I would look at it more from a holistic management of that operation and not necessarily to target that the medicines are not working properly.
Okay, great. Certainly, and you also mentioned some alternatives. to antibiotics that can promote gut performance. Obviously, that's one of Biomin's main focuses and where we dedicate a lot of research and have a number of different products on offer. Related to this topic, and we have another question that came in, again from the poultry side of things. So this goes back a little bit in the history books when Europe banned AGPs. So did the ban on antibiotic growth promoters have an impact on intestinal health? And here there's a bit of a personal experience that's shared. It says, so this individual says, we found increased gut health problems such as necrotic enteritis and coccidiosis when we removed AGPs from our system. Is that common?
Well, with the AGP, I think coccidiostats in Europe you were able to still continue using that. So again, I go back to the hygiene and the progressive management pathway. To be able to outright ban without being able to have the investment to improve certain other aspects, I think can cause a dip in your production scheme. Was it very abrupt for Europe? I'm sure that there are a lot of producers would have thought it was. Others probably thought it was not, that it was about time. But those that probably were ready for it had already taken the right actions at the biosecurity management level, and those that relied on the antimicrobials for their profits to ensure that the animals were not succumbing to disease probably were not so ready. And I think that that is also a reflection about many places around the world. So that's why I'm against banning outright the use of antimicrobials without having something to replace it. That education, hygiene, management infrastructure, looking at nutrition, the feed additives that may be able to compensate and not for the producer to lose.
Absolutely. And I know that we've hit our 1 hour session here, but if we could just add a few more questions for those who want to hang on the line, please do so. And this is shifting a little bit of the discussion to the current context, right? So in terms of where we sit today, post COVID-19, that the world is dealing with this pandemic in many places, when food production will be the driver to narrow the widened demand-supply gap. Is it possible that antibiotic reduction might take a severe beating? Now, I guess by that wording suggests, does this fall off people's radar? Does this take a back seat to simply producing enough food in the current macroeconomic context?
Excellent question. I think we all realize, and we're all grateful, when we do, at least in Italy for the last couple of weeks, to be able to go to the store and see that there are things on the shelves. May not be all the same, the brand that you had expected or that you had bought previously, but the shelves are maintained. And I think that is one of the communication issues that I will be writing about in the next maybe hours or days, because I went to the supermarket yesterday after about maybe 5-6 days, and there are unsung heroes, those that make sure that the food is coming in. Is antimicrobial resistance as a subject taking a back seat? Perhaps it has, but I think that we could change the discourse to looking at our food systems as a whole and make them consumer safe, and that will include many different aspects, including the use, abuse, misuse of antimicrobials or additives or colorings or whatever have you in place. It may also affect, I think, for a while, maybe international trade. Maybe you do not want Peking duck coming from a certain country, or you may not want sausages coming from a different one. I don't know how that will pan out. Certainly, the xenophobia with coronavirus has no place in this world of ours. At least this is my opinion. And the virus does not have a nationality. Our food systems are interlinked across continents, and we have to be ensure that they're safe.
Absolutely. And you said you would be writing on that, if I heard correctly. So as you develop your thoughts, where can people go to look for your writings?
I'll get back to you on that, Ryan. I'm not too sure. For your listeners, I just retired from the Food and Agriculture Organization in December. I was thinking of having my website with a blog. We'll see where I take it. Maybe it could be a letter to the editor.
Absolutely, absolutely. Yeah, and if I'm not mistaken, we can also find you on Twitter these days.
Oh, I haven't been active in Twitter in quite some time. It reminds me of others at Twitter that I don't necessarily. I'm not too sure.
Okay, we will stay tuned, and we will look forward to that in the future. I
want to thank Biomin and everybody. Okay.
And if you don't mind, because we do still have everyone, a lot of questions coming in, and we'll try to handle one or two more as we pivot towards closing our session today. Do you, in your opinion, consider it necessary to put in place some sort of antibiotic-free ABF, no antibiotics ever, certification system within the food production in order to convince consumers that antibiotics are not being used, or that antimicrobial resistance is not being caused or contributed to as a risk?
I think the certification would be a national responsibility, and probably very much consumer driven. One side is, yes, the consumer does not want this particular, or wants to see this particular label. And it would be up to the governments to be able to certify that, or the industry to certify that through a system of very similar to organic or whatever that means, or biologic. There's an aspect of what happens if in a antibiotic-free environment, if those animals had been sick and were not treated, and therefore there's some animal welfare issues associated with maintaining antibiotic-free status. There's some ethical questions there, but that's I'm putting that out for consideration, which is different from the question which is on the certification process. Do I support it? I would say it's consumer driven. For me, there's a withdrawal period for these antimicrobials. Should they be needed, they should be used to avoid animal welfare issues, and certainly the legislation on the withdrawal period, whether for milk or meat or eggs, that needs to be documented.
Right. Okay. Thank you for your view on that. I want to go ahead and ask you just one last question before we end our session today, and it's, looking ahead, let's say a 5-year window, where do you think we'll be on this topic, or where do you hope we'll be in terms of making progress against antimicrobial resistance?
Good. Taking me to the progressive management pathway. Where do I want to be in 5 years? Well, when I look at Northern Europe, which is often highlighted, the Scandinavian countries in particularly highlighted as good models, it took them 2, 3, 4 decades to get to where they are today. So I think in a 5-year window, yes, we can have 5-year work plans to see along a progressive management pathway with a vision of where you want to be. I don't think all sectors will be at the same place together. there were quite a few poultry questions. I think the poultry, swine, and some of the aquaculture sectors are probably notoriously behind others, let's say the dairy sector, which is much more advanced. So we will see a mosaic of advancement of where we want to be. 5 years is maybe short, particularly in low and middle income countries. I think in the next 5 years, keeping up the pressure to be able to have inexpensive and efficacious vaccines made more available in the veterinary realm to bacterial pathogens can be quite important, as well as point of care diagnostics to be able to rapidly determine what is the best medicine or drug to use, to be able to take the feed industry into more proof of concept, to be able to showcase that these feed additives do balance or be able to have the economic advantage of using that and not antimicrobials. We will have a lot more publications to be able to showcase that. I think these will be important areas. Mm-hmm. Certainly, I would like to see more improvement on the poultry and swine sectors.
Okay, excellent. Thank you for that glimpse into the future. And Dr. Lubroth, I want to thank you for your time today. Really appreciate your perspective on this important issue. I want to thank you for being available as well and joining this virtual forum for discussion. Thanks again for joining us as our first speaker in the Antibiotic Reduction Expert Series. The webinar series itself, brought to you by Biomin, will continue with additional speakers, and the lineup will be announced in the coming weeks. So please look for that and stay tuned. In the meantime, I'm going to ask everyone in our audience who's stayed with us past our time to please take a minute to give us your feedback. Once we close this session, you'll receive an option to complete a short survey. It only takes a minute, and it's going to help us to develop the series further, and we'll be able to use your input to make this experience and make these topics better and a better fit for your needs to help you with your business. So to everyone, and on behalf of Biomin, thank you for joining. Stay safe, and we'll see you next time.
Thank you.